In this video, I'm going to cover the simple progression for the high oblique seat. It's great exercise actually when I'm trying to get a patient or somebody to start loading the hips kind of a little bit more into the rotation. So I would use this when the person is just not able to fully weight bear. So if there is some knee ankle issue, or if just in the standing position there's just too much pressure on that hip just yet. Also, if the person would be just not able to kind of isolate that motion in the hip. So let's say the whole rotation would be kind of tweaking the knee, tweaking the foot, and the hips wouldn't be moving. So this helps to kind of isolate that motion in the hip and gives that person a little bit of experience of how it is to move that pelvis around that femur, around that leg, how to load it, and it's going to provide nice loading for the iliolumbar ligaments, for the SI joint, and for all of the glutes. So that's short the benefits. So the setup is going to be very simple. You're trying to align this leg initially first parallel with this line, so the arm, the leg, they're going to make a triangle where this is going to be the right angle just over here. The next step is going to be just straightening the body, so you are not in this position, you are kind of, there's a straight line from the shoulder into the hip. Then the next step is going to be just putting the hand on the pelvis, and again, because you are nice and straight, it should be just over like this. Then the next step is going to be just moving that pelvis kind of back and forth. Usually when I ask people to reach, they usually leave their pelvis behind and they just rotate from the upper body. So this hand just brings the little bit of extra awareness that, okay, what we need to do is actually just rotate the hip by itself. Then the next step is going to be just rotating, holding, trying to go as far as you can. There shouldn't be any pinch in the hip over here. There should be just nice stretchy feeling on the back side, on the hips. If there is a pinch, you can play a little bit with this angle, which there is no right or wrong. Higher angle you're going to get, more you're going to close the hip joint, so more pinch you might get, but everybody's a little bit different. Or more you open it up, there is going to be a little bit less, more space and less chance of pinching. And then when we get this rotation, this loading, then the next step is going to be, while maintaining that rotated, loaded position, you would just lift a little bit up, hold it for a few moments, slowly lower it down, go back, rotate, lift, slowly lower, go back. The common mistake with this is as they rotate, when people get up, they lose that kind of lengthening, that eccentric contraction, and they open up just like this. So the goal is keep that rotation and lift, and almost like keep rotating as you're lifting. And then the next step would be just removing that back leg, so you are rotating, lifting, holding that rotation, lowering down, and just rotating back, rotate, lift, over here, and then it would go all the way into, let's say, like stepping. But generally that stepping is actually a little bit too easy, or it's easier if you manage that transition well. That's kind of that position where that hip musculature and all of the ligaments go through the lot of stretchy feeling, stretchy position, and then they need to contract in that lantern position. So advantage of this in comparison to bridges is, let's say in the bridge we are just going kind of from the mid-range into short. Similar actually with the climbs, or similar with any kind of lateral bend walks. In this exercise we are getting that glute and those hip rotators into nice full length while asking it to rotate. So it resembles a little bit more, I guess, the walking or hiking or these kind of things, where oftentimes people just complain about that stiffness around the SI joint and the hips, and with this they just get used to lengthening, letting go those muscles, using it, and it tends to help quite a lot. This can be then progressed into the standing, into the kind of reaches, deadlifts, with the reach, just few rotation drills, because like being able to do it on the ground, it's amazing first step, and oftentimes for some people it's enough to get them out of pain and pretty much improve the function. But if you are talking about some athletes, people who are doing either long duration or high speed or just different ranges of motion, we just need to train and prepare them for that, and hopefully try to bridge that gap in between where they are when they need to be, so they have enough control, enough buffer zone, so they can do what they want to do, can do, just nice and safe. So that's pretty much it. Hopefully this was helpful. Have a great day.